Hello everyone, my name is Dr. Vivek. I'm an orthopedic surgeon. I'm going to talk about osteoporosis. It's a fairly common problem affecting most elderly people. It's got devastating results, and a lot of changes can be done once we conquer osteoporosis. Osteoporosis is basically weakening of bones. The calcium in the bones forms the basic concrete in it, which leaches as we all age, and we call this as osteoporosis. What is the prevalence? Osteoporosis in India, 1 in every 3 women and 1 in every 5 men after the age of 50 will have osteoporotic fractures and will have osteoporosis. Now, such is the common, that means almost 30% of our population in elderly women are osteoporotic. Now, how it affects? Osteoporosis makes our bones weak. Osteoporosis makes it less dense and poses a threat for fractures. It increases the risk of fractures and the quality of life is affected. What are the things that we can do to reduce the risk of osteoporosis? Yes, being active, having an active lifestyle is the most important factor where to a large extent we can prevent osteoporosis. The other important aspects are nutritional supplementation using vitamin D and calcium supplementation. And also some risk factors associated with osteoporosis. As I already mentioned, being less active is a major risk factor. For women specifically after menopause, the hormonal effect on the bones, which maintains the common milieu, how the bone is managed, is taken off. So net on a decade to decade, on a year to year basis, there is leaching away of this calcium from the bones and the bone becomes weak. Other risk factors involve diabetes. Medications that we take for common ailments can also in a way affect absorption of calcium and at the same time lead to osteoporosis. Now, why are we really worried about osteoporosis? In the current scenario with medical technology advancement and a lot of other changes, ease of facilities available, the longevity of all of us has increased. People are living for longer duration. That also comes with more problems like weakening of bones and the risk of fractures. So what are the things that we can do? Yes, as I mentioned, activity, nutrition, and most importantly, we have more specific aspects to prevent osteoporosis, being medications, which are there in various forms. Normal recommendations would involve injections or medications in terms of tablets. How do we diagnose osteoporosis? Now, osteoporosis we can quantify or we can measure the degree of weakness of bones by doing a scan called as a DEXA scan, which measures the approximate value of calcium present in a square unit of the bone. Based on that, we can tailor the treatment for osteoporosis. Now, if a person with osteoporosis has a simple fall, there is more risk. The problem with osteoporosis is calculated as the risk of fracture a person is posed. So, meaning to say a person with osteoporosis has a higher chance of sustaining fractures. Now, there are certain fractures which are very typical for osteoporosis, namely spine fractures, hip fractures, and wrist fractures. Normally, the fractures involving the hip are the ones which really cause a major issue when it comes to osteoporosis, because most often than not the treatment would involve a major surgery. Now, when we're talking about surgery in elderly people, there are a lot of issues which revolve around a surgical treatment for elderly people, namely medical conditions, diabetes, hypertension. Those are again some risk factors which would increase the morbidity, even mortality following surgery or during surgery. And when we talk about fixing fractures and replacing the joints with osteoporosis, yes, there is an inherent problem where the surgery can fail because the bones are not strong enough to even hold the implants that we use. So, understanding osteoporosis and preventing osteoporosis, according to me, is the most important factor, and it is easily achievable. The only thing involved with osteoporosis is a high degree of suspicion, and we compel patients to follow the instruction and follow the medications that we prescribe for osteoporosis.